families, to their elders, to their children, to the disabled, to people who are working families who are not provided health care through their employers, so they rely on Medicaid. This is a working people's problem. This is not freeloading. This is American, and this is what our people deserve. So let's talk about this horrible bill. They think they just keep improving it? Well, they're making it worse, right? They're making it better for the rich. And how are they doing it? They're doing it by taking away coverage from 22 million Americans. So when they make something they call a health care bill that takes away health care, we say no cuts. And so for all of our brothers and sisters who have jobs and who are blessed with employer-based health care, remember, you're in this fight too. Because this bill will take away coverage from 27 million of you who think you're getting it from your employer. Because guess what? Cuts are back. They can put limits on your care. They can put limits on your lifetime. So if you've already had your cancer in your family, if your child was already born premature, their coverage might already be used up. So don't think this is a fight for the people, for the poor and the disenfranchised. This is a fight for all of us. So when they say that they're going to take away our benefits, we say no limits, no limits, no limits, okay? Limits. And again, the Republicans like to make it sound like people just need to go out and get a job. Well, I want our Republican senators and congressmen to do their jobs. Because this bill is not about, this job is not about your stereotypical made-up healthcare welfare queens, your fantasy stories about how poor people are just trying to freeload. Poor people are working hard. They're working 1, 2, 3 jobs to feed their family, and they're not provided health care. And let's tell the truth, they're not even making a decent wage. So this impacts the working poor, the elderly, who have lived their lives and deserve the coverage. Half of the people in nursing homes are dependent on Medicaid. When we say we cut Medicaid, we're not cutting freeloaders. We're taking it away from our elders. It impacts the disabled, the weak in our society who are fighting for dignity and who have fought a long fight and who deserve the protections and coverage of our society. That's what our tax dollars are for. That's why we pay. And Medicaid, let's face it, is the largest health care provider. So before we start worrying about the profitability of the healthcare industry, the for-profit healthcare industry, let's worry about the largest provider in our country, who provides for 1 in 2 children in America, who provides for our elders in nursing homes, who provides for the disabled. Working poor, elderly, children, the disabled, those are the ones who will suffer if this bill goes forward. So we're asking, how can our governor remain silent in the face of this devastation for Illinois? We have over 700 days with no budget, and yet this bill will blow a hole in the budget because we are dependent on Medicaid dollars to take care of the people of Illinois. And we are dependent on Medicare dollars to employ the people of Illinois. Because this could impact 60,000 jobs in the state of Illinois, and yet they're trying to push it through. Let's not get complacent that they're taking a break and not voting today. Don't kid yourselves. They're making backroom deals. They're lining their pockets. They're trying to figure out how they can make it work for their states, right? But those deals cannot be made off the backs of average Americans. So we say no to the cuts, no to the limits, no to the tax breaks for the rich. Our Governor Rauner stands to get a $6.6 million tax break if this goes through. That ain't right. Right, so wait, let's take through this. This is going to benefit millionaires and billionaires like our governor, not the people that he has sworn to protect. So that's why we are here today with a petition on the behalf of thousands of Illinoisans to call for the care.